Welcome back to my channel. I'm Bree, and today we're going to talk about some tips for new nurses and what you can expect on your first day of orientation. So the first tip is to be open to learning from everyone. As a new nurse, there's so much knowledge to be gained and built upon. There are many people in the unit with years of experience and knowledge that they can share with you. This doesn't just have to be nurses. This can be techs, providers, PT, OT, or really anybody who has additional experience that they might be able to share with you. Number 2 is to show up early, especially for your first couple of weeks. This will allow you to adjust to the unit and to also get a little bit more background on your patient before you actually receive report. This will allow you to ask more targeted questions when you actually do receive report. Number 3 is to be cordial with your preceptors. The relationship you have with your preceptor can profoundly impact the knowledge that you gain and overall experience that you have during orientation. All preceptors are not made equal, but you have to make the best of the situation and gain the knowledge and experience that you need from them. Communicate with them in a professional manner when times are hard. This can help improve negative relationships and ultimately help move forward in a constructive manner so you can gain what you need from your orientation experience. Number 4 is to bond with patients and families. Some of the patients and families that you encounter will be experiencing a very hard and stressful point in their life. As their nurse, it is your job to be compassionate and provide whatever comfort you can during times of stress. Compassion and consideration are what makes nurses so special. Number 5 is to master good communication skills. Bedside nursing entails a lot of communication. This can be with the patient, family, colleagues, providers, etc. As a nurse, you must master communicating what is necessary in a clear and compassionate manner to patients and families. You must also learn to express yourself clearly and appropriately with colleagues and providers. The way you communicate will have an effect on how people view you and ultimately determine their interactions with you. Number 6 is to get comfortable with remaining calm in alarming situations. Some situations in nursing can be so stressful and can be very chaotic at times. It is important that you as a nurse remain calm because if patients and families see you freaking out, they will follow suit and this will result in everybody being in disarray, which is not a comfortable environment to work in and to rectify this situation. Remember that even in an emergency situation, it is not your emergency. You are okay. You are not the one requiring immediate attention. Take a step back, put on your brave face, ask for help, and do what needs to be done for your patient. Number 7 is to learn how to prioritize. Prioritization will look different on every single unit, but it's important to learn how to prioritize based on your patient population. Generally, you will prioritize the most unstable patient or the patient with the most urgent needs. You can get different ideas from preceptors or other nurses on the units that are more specific to your practice. Prioritization will determine how efficient and effective you are as a nurse. This will be a skill you master over time, and you will learn what things require more or less attention as you grow and gain more experience. Number 8 is to don't be afraid to ask for help and embrace teamwork. No one knows everything, and as a new nurse, there's still so much to be learned. Asking for help is a way to gain new knowledge while practicing in a safe manner for your patients. Nursing is a team sport, and you are not expected to do every single thing for a patient alone. Other members of the treatment team are there to do their part and support the patient as well as support you. You are not expected to know everything, nor are you expected to play every single member of the healthcare team. Don't be afraid to ask for help from others and use your available resources because that's what they're there for. Number 9, and probably most importantly, is to take care of yourself. Nurses generally have a hard time caring for themselves after spending all day caring for others. They generally put themselves last when it comes to providing self-care. Doing this can lead to burnout and stress. As nurses, the only way to efficiently and effectively take care of others is to take care of yourself first. Okay, so what can you expect on your actual first day? You can expect a lot of confusion and gibberish. This is especially true as soon as you arrive on the unit and are receiving reports. Many units use different acronyms and abbreviations that a common person might not know or that you might not have heard in nursing school. On my first day, my report sheet was filled with a bunch of words and information that I did not know nor understand. After receiving a report from the off-going nurse, I sat with my preceptor and we went over it and I was able to get a better understanding of what was actually going on with my patients. So you can also expect a tour. An in-depth tour of the unit usually comes on your first real day on the unit, even though you might have seen the unit beforehand. This is where they show you all the places that you will use on a regular basis. These places can include a med room, a clean supply, dirty supply, equipment storage, things like that. This tour will show you where you can get the stuff you need on a regular basis to take care of your patients and to just get your bearings a little bit. You can also expect to be bombarded with a bunch of new information. You will learn about your specific role as a nurse on the unit and how things are done specifically on your unit. You will also learn about different conditions that are specific to your unit and also to your patient population. Your preceptor may also show you some tricks and tips that they've learned on how to do certain tasks that might make your life easier. Pay attention to this because this is stuff you will use on a regular basis on your unit. Everyone's orientation will look differently depending on your unit, specialty, and facility. Enter orientation with an open mind and a willingness to learn. Do as much as you can and advocate for your learning and progress while you still have that preceptor by your side to help and guide you on your journey. Thanks so much for watching. If you found this video at all helpful, like, comment, and subscribe. And let me know about what you're most excited about for orientation. Bye, guys.